Hello, good afternoon, good evening, and good morning to everyone who is joining this social media live Q&A on measles. I'm very pleased to be joined by two colleagues today. My name is Alexandra Kuzmanovic, and I will be your host today. We have two guests, two colleagues, Natasha Crowcroft, who is our senior technical advisors on measles and rubella. Natasha, thank you for your time today. I don't think we've done these before in this format, so thank you for your time. And we also have my colleague Lisa Manning, who is team lead for vaccine demand and behavioral sciences. So, Lisa, welcome back. I think we've done some of these conversations before with you.
A little while ago, but it's good to be back. Thank you.
Thank you very much. Before we go into the questions and topic of discussion, which is measles, I just want to remind our viewers, for those watching us on X, please use the hashtag AskWHO to send your questions. If you're watching us on other platforms, please use the comment section. We have a team behind the scenes who is curating those questions, passing them on me, and then I will pass to Natasha and Lisa. So please be active and send us your questions. But to set the scene, maybe Natasha, I'll start with you. Our European office recently reported 30 times increase in measles cases in 2023 since a year before. So could you please tell us more about this trend in Europe, but also in the other parts of the world? Is measles on the rise?
Yeah, measles is on the rise everywhere, not just in Europe. I think Europe got a lot of attention because it released the figures, but we're seeing increases in measles everywhere. And in a way, we've got a perfect storm coming this year. We're really worried about what's going to happen because during the COVID-19 pandemic, childhood immunization slipped down the priority list. And so kids didn't get vaccinated, and now we're seeing the results of that. We didn't see it during the high points of or low points of the pandemic, but we're now, the chickens are coming home to roost. We're seeing it now. And so it's exploded in Europe. I think it's going to really take off in other regions soon as well. So yeah, our concern is very high.
Thank you very much, Natasha. And I think it's important here that you're stressing that not enough children receive their routine immunization. But Lisa, we're also seeing a lot of coverage in the news that the problem around measles vaccination is misinformation. So is misinformation also driving increasing cases? And maybe you can tell us about other causes as well.
Yeah, absolutely. Thanks, Alex. And indeed, there is almost a tendency to oversimplify our explanation of the causes of these outbreaks that are happening around the world. And as Natasha suggested, during COVID, there were a lot of disruptions to health services. And at the same time, people were cautious about going out and also accessing health services. So that's one reason in recent years that contributes to the outbreaks today. But there are many others, and we know that often there are challenges to access. The vaccine services are not always located in an easy to access place or at the right time for people. People live very busy lives today. So there's a dimension there which is about the availability and even the affordability of these vaccination services. There are many other factors as well, such as social influences. So maybe someone in their social circle is also not supportive of vaccination, a community leader or a local authority who's also not entirely supportive. And at the same time, yes, information is important, and we do want to help ensure that people have access to trusted, accurate information about the importance and benefits of vaccination, which also contributes. So in many ways, it's a multifactorial effort, and programs need to be thinking about all of these various considerations that help contribute towards high uptake.
Thank you so much, Lisa. And Natasha, you said measles is on the rise everywhere. Can we a bit elaborate what does that mean for our viewers? Does that mean that every single viewer should be worried, or there are places where we are seeing spikes and outbreaks, and who is mostly at risk?
So thank you for asking that question. We're not in the business of making everybody scared for themselves, so I don't intend to alarm people. I think if you're fully vaccinated, 2 doses is what we recommend, then you really don't have anything to worry about. The people who need to be concerned are really people who aren't vaccinated or people who have immune problems. So in the case of young children, especially infants under 1, they're the most vulnerable, and they can't be vaccinated until we start our routine immunisation at either between 9 and 12 months. So in that run up before that period, that's when they're very, very vulnerable, and most of the deaths from measles occur in infants. So this is why we need everyone to be vaccinated, because that's how we protect those young babies. So the other group of people we're really concerned about is anyone with immune problems, and they generally can't be vaccinated themselves and can't get protected. So, if you've got some kind of immune problem, you're having cancer treatment, then you need to make sure that the people around you are vaccinated. So the healthcare staff who are looking after you, your family members, so that they can't bring it to you. I think one of the things people don't, I'm asked about, well, where do we have to be, where are the hotspots, where do we need to worry about? One thing I wanted to say was, I really think people should think about their own susceptibility and not about where they are. Measles may sound like something that's happening somewhere else, but this virus is one of the most infectious viruses we know about. And so if there's measles anywhere in the world, it can arrive by plane in your town, in your village, in your community, in a matter of a day or less. And so, we see this happen in countries where measles is very well controlled and where coverage, uptake is very high, but all it takes is one person to arrive in the wrong place at the wrong time, and someone else will catch measles from them, and that can be devastating. So that's why, this idea of, where do I need to worry about? That's really not the right question in a way. The question is, am I protected adequately? Are the people around me protected adequately? And that's what I think is the really important thing.
Thank you very much, Natasha. And maybe we are starting to receive some questions, but I would like maybe also to remind our viewers, how would you describe measles as a disease? How serious it can get?
Yeah, so I think one of the problems we really face with measles is this idea that, it's just measles, it's okay, you get a bit of a fever and a bit of a rash. But the reality isn't quite like that. I mean, when I was a medical student, I spent some time in Kenya, and half of our ward in the pediatric department was full of really sick kids with measles. And it's something that people in high-income countries have forgotten about because they don't remember. In fact, measles vaccine's been around for 50 years. So it's not just that parents don't remember or healthcare providers don't remember. Even our current grandparents often have never really seen a case of measles. It's, we forget how successful this program's been in countries where we have high coverage. But measles, it can be very severe. About 1 in 5 kids will end up in hospital, which on its own is terrifying for a parent. About 1 in 20 kids will get pneumonia. And then even ear infections can lead to long-term deafness, for example. So some of the things that are more common, they can have life-changing consequences. So the more severe infections that are, outcomes that are a bit rarer, like encephalitis, that's about 1 in 1,000 kids will get encephalitis, and that can cause brain damage, and that can also cause deafness. So that's on the more severe end. I don't think people really understand that even in a high-income country, this can be a really serious disease. In infants, round about 1 in 1,000 infants will die from measles. If that child has got malnutrition, it's even higher than that. And so anyway, I'm trotting out these numbers, but one thing I wanted to say was that we as human beings are not very good with these numbers, with risk. All of us are not very good at understanding risk. So I really struggle to make it real to people, because I remember speaking to a teenage daughter of a friend of mine and saying, it's about 1 in 1,000, maybe a bit lower than that. And she said, is that all? As if that was, that was okay. And I was thinking about it afterwards and thought, well, I don't know how, if I said to you, driving's fine, but about 1 in 1,000 times you're going to die, you would think twice about getting in your car. There's something different about measles that people think, that's okay. I don't know. I really struggle to understand this. So when you look at the numbers, it's not it's not a good thing to get measles. It can be extremely dangerous in infants, and we have a safe and effective vaccine that can stop it completely.
Thank you so much, Natasha. And it's important as well to, as we look into situation as a global health organization, that we look into numbers from all over the world, and then we do inform people about those numbers. But behind every number that we communicate is actually a human being and a life. So it's important to look at from that perspective. And there is one question going into a bit as a follow-up to what you were just saying from Adam and Manuela watching us on LinkedIn. Can measles kill when not being treated, or does it cause abnormalities in the body when it's not properly treated?
So, measles infection can kill. I think I just said that. So thank you for your question. It can kill, and it can cause. I didn't mention pregnant women actually as a risk group, and pregnant women are at risk for measles if they're not already vaccinated. So in a pregnant woman, it can lead to a preterm birth. That means, the baby's born early. A premature baby is at risk of all sorts of problems. And it can also cause a low birth weight baby. So small babies are also at risk. It's not in itself, it causes complications, as I said, like it can cause deafness, it can cause brain damage, a whole host of complications of measles. So, and none of those things are seen with the vaccine. So we know we can prevent all of them. I don't know, does that fully answer the question?
Thank you very much. Lisa, I'm going to pass this question to you from Chica Ella watching us on Facebook. Why do you think people are skeptical in taking vaccines, including that of measles, for their kids?
Yeah, it's a good question, and absolutely there are a variety of reasons. And I think the first really is also just being aware that these diseases are dangerous and deadly in the first place. So that's one thing. But then secondly, that vaccines are supported by scientific consensus. We have been using these measles vaccines for decades and, rolled out at billions of doses in many ways. And amongst all of that, it's possible that there is misinformation, there are rumours, there are questions and concerns. We are giving a vaccine as a health intervention to a baby who is healthy. And so there are these aspects of giving a medicine or an intervention to a baby or a child who is healthy. And people then want to be cautious and want to feel like they're reassured and informed about that. And then they do turn to people they trust to answer those questions and concerns, and that might be a friend, a family member. Often it's a health worker, their doctor or a nurse that they know well. So they would turn to someone that they trust to share with them maybe their questions and concerns and to have that addressed. And it's always possible that, vaccination is a really prominent topic. There's been a lot of attention during COVID, just generally on the topic of immunisation. And so amongst all of that and all of that interest, it's also possible that, there's kind of these topics getting intertangled and people stepping back and saying, well, I never really had any questions about childhood vaccination, but then I heard all these other things about COVID, and that makes them think twice as well. But, at the end of the day, we have decades of experience and evidence that really does support the safety and benefits of measles vaccines and all the vaccines that WHO recommends. So really, I think that in many ways, it's okay for people to have questions and concerns and want to explore those. But at the same time, we really, really want to make sure that programs and partners and other champions and advocates can really be active in supporting sharing of accurate information as well.
Thank you very much, Lisa. We're getting quite a few questions about vaccines. Natasha, there's one we were asking if there is a safe vaccine. So I'll expand the question because we are talking now about vaccines. So there are safe and effective vaccines, but are there a few? There is one. Can you tell our viewers more about the variety of vaccines?
Yeah, the vaccines are all very similar, to be honest. the biggest thing that varies is whether it's just measles vaccine or whether it's combined with measles, mumps, and rubella, or just measles and rubella. Most countries in the world now use at least measles and rubella combined, and many countries use measles, mumps, and rubella. And there's just a few countries left now that only use the measles vaccine. So that's the biggest variation. But what's actually in the vaccines really doesn't vary very much. We have different manufacturers, but we're using vaccines that we know a lot about. This is the whole, it's how we approach things in immunization. As I said, we've got 50 years experience of using it in our essential program of immunization, and that really shows us how safe it is and how effective it is. So I don't think anyone should have any questions about it. There isn't you should use this vaccine or that vaccine. If you're, which is the best vaccine is the one that's in your national program. And every country in the world has a measles vaccination program.
Thank you very much. And there is a question, is 2 doses enough for protection?
Yeah, 2 doses is what we recommend, and it is incredibly protective. It's like 97% if you have your 2 doses. So we don't routinely recommend anyone has more than that, unless unless their healthcare provider recommends it. I mean, if somebody gets sick, for example, and needs cancer treatment, we may need to revaccinate them because of their immune system's been disruptive, and they may have forgotten, their immune system's kind of forgotten the immunity it had before. But in other situations, 2 should be fine. It's not to say that you won't ever get measles after getting 2 doses. It is possible, very rarely, and most of the time it will be a mild version of measles, so it's not anything to be concerned about.
Thank you very much. When is the best time to get measles vaccine?
Well, that varies on where you live. And so WHO recommends that in most countries are giving vaccines starting at 9 months of age. In high-income countries, it tends to start at 12 months of age. And then in a very high-risk situation, you can start at 6 months. But we don't count that dose. So if you get a dose at 6 months because it's high risk, for example, it's the middle of an outbreak and you want to protect a baby, or a baby has to travel and is traveling to a place where there's a lot of measles, then we'd start at 6 months. But we don't count the dose. So we still give them 2 doses after that. So the age varies depending on where you live. And it's highly effective wherever it's given and whenever you start it, as long as you complete and get those 2 doses.
Thank you very much. And maybe a last question about this. When do you get vaccine? We got a question from one viewer, if senior citizens should revaccinate or the protection lasts for life.
Right. So senior citizens would not have been vaccinated as children because of when measles immunization started to be routinely used. So because measles is so infectious, we would anticipate that virtually every senior citizen should or would be expected to be immune, having had measles as a child and survived and grown up and lived to hopefully a healthy old age. So we don't routinely recommend it in those age groups that would have had measles as kids. And for example, I was born before measles vaccine was available, so I would have had measles as a kid, and so it wouldn't be routinely recommended for myself, as an example.
Thank you very much, Natasha. Lisa, here's a question from someone also watching us on LinkedIn. Mm-hmm. What is being done to change the narrative around the myths about measles and measles vaccines?
Mm-hmm. Yeah, very good question. And as WHO, we are doing a lot to share accurate information and to help equip partners and advocates and champions that we work with to equip them also as trusted voices in immunisation. So we work with and through many partners, many NGOs, civil society organisations. We have our network of regional and country offices as well, and we're supporting them in also the onward sharing of information information. Other activities, even like doing this Facebook Live, this event today, this is how we're trying to have a conversation and really support the conversations of others, particularly those who are trusted in their communities. So we're working on this at many levels through many other individuals and types of organisations, and also across society as well. So through medical associations, nursing associations, youth networks, religious groups, really also just trying to help equip them with tools and resources that articulates the kinds of common questions as well that we do often hear, and also making these easily accessible so that they can be easily translated and made available in local languages, and also at a level that's easily understood by many different audiences. So we're approaching this in many different ways, and hopefully along those lines, just trying to avoid there being any gaps. That said, that its myths and rumours do spread very quickly around the world, and we do try to anticipate and listen. The work that we do in actively listening and monitoring the information that's available online and in media, and that also helps to inform our activities. So it's really this ongoing effort of listening and responding and trying to stay ahead.
Thank you so much, Lisa. And I'm glad you mentioned that also listening component, because we're using also social media a lot to listen to conversations, as you said, people's concerns. And this conversation is based on quite a lot of concerns or questions we've seen on social media. And there was a question as well on the role of social media. And we also worked recently together on measles content, where we were testing different messages of how do we frame message to make it more effective. So there was a question about TikTok. So maybe this is an invitation to you to also do something for TikTok. So we will need to be creative to bring our experts to TikTok to talk about measles. Speaking of, there is also a question, Lisa, I think it's for you, from Ilkay Baseski. How do you think that as healthcare professionals, will be able to eliminate the conspiracy theories around vaccination? It concerns me that every day more people are denying.
Yeah, that's a great question. And putting the focus on health professionals and health workers is so key. Health workers are our most precious, important asset in the health sector, and really equipping and supporting them as champions and advocates, and really just helping to make sure they're well trained and well supported. Health workers are often, in most cases, the most trusted source of information about vaccination, and they're the people that parents would turn to first if they have questions or concerns that do need to be addressed. So we really do so much to, again, work through our partners and our networks to help equip and support health workers to have the right information. And it's also possible that even a health worker could have their own questions and concerns. So again, we want to create space for that to make sure that those can be heard and addressed as well. So we really place so much importance in the health workforce as our most trusted asset, and really getting behind them and making that recommendation to ensure that they are supported to play this important role.
Thank you. And Lisa, part of your... Oh, sorry,
just
Natasha,
comment on that?
Please go ahead.
Yeah, just to say, I mean, I fully agree with everything you said. And I think we have to acknowledge that it's been a really tough time for health workers. It's not at all surprising that we see we're in this situation, because health workers everywhere have been absolutely slammed by this pandemic. And they're still exhausted. And many have left. So I know many countries are having trouble with recruitment. And so, you imagine the scenario where a worried parent comes to a very busy clinic, and the health provider just doesn't have time for them. I mean, these are basic, it's not rocket science, they're basic things that can make an experience less affirming when you go to get your kid vaccinated, and leave you more worried because no one has time. So we need to, as you said, health workers are our most precious resource, and we really need to look after them. And there's some research showing that just having a friendly face when you arrive at the clinic makes a difference. So it's, as I said, it's not rocket science. It's giving. I mean, the question is a health worker. I didn't hear the name, but you know, if you haven't got time for your patients, or you're really stretched, then it's very hard. But if you've got time for a smile and time to build a relationship, it's gold.
Thank you very much, Natasha. Lisa, I wanted to follow up because part of your job, or like your job, is to work on behavioral science and how we can help influence positively people's behavior to protect their health. So, can you tell us a bit more about this work? How WHO is actually doing that? We are known to be a technical and normative agency, so social science is not as been in every program as involved.
Yeah, that's a great question. Thank you for asking that and the interest. And social and behavioral science is really about understanding people and thinking about all of the various factors that shape their beliefs and experiences and social influences and other types of influences or enablers in the context in which they live, either socially or even how far it is to get to a health centre, and is that convenient or not. So really what we try to do is put people at the centre of programs and have an understanding of their beliefs, their experiences, the influences, their interactions with structures, etc., and use that as a basis for then designing vaccination services. So, for example, some of the work that we have been doing in recent years is working with partners and experts to look at all of the evidence on behavioural sciences as it applies to immunisation, and saying, how do we translate, in a way, all of this evidence and experience about people and the social and behavioural factors, and how do we then make that into guidance for evidence-based guidance and tools for programs so that they can put people at the centre of their programs. And health starts with behaviour, in thinking about whether it is something like eating a healthy meal, taking exercise, deciding to vaccinate your child. There are all of these factors around people, and we really need to pay attention to all of those experiences and beliefs and attitudes and intentions, and design programs that are responsive to how people feel and behave. So that's really the starting point. And by doing this, we can actually then help programs to be as successful as possible. And what we want to avoid is making assumptions then about how people behave and the components of what drives those behaviours. So we do want to make sure that we're listening and carrying out behavioural research or other types of data collection that enables us to really listen to people and understand their thoughts and feelings and experiences, and then respond accordingly. And doing that together with our technical colleagues or other experts who really then bring together all of these various components of a program. So we work in partnership in many ways as well.
Thank you very much. There are quite a few interesting follow-up questions to this. Natasha, maybe you can start with answering to Nadine Sashek. Can't the WHO prepare a nationwide campaign for healthcare professionals, which we then in quotes, have to implement?
So thank you for your question, Nadine. So a nationwide campaign for training health workers, have I understood that correctly?
I think prepare a nationwide campaign for health. So it can be considered, it's not specified, it can be considered vaccination campaign or public health campaign.
Public health, yeah. I mean, I think we can, WHO, in terms of our headquarters role, we can definitely provide guidance, and we do provide guidance on what care worker immunisation should be in place. And our regional offices support all the countries in things like campaigns that could be directed at health workers or could be directed at the whole country. And we help support those all around the world. So many countries need to run regular immunisation campaigns for the population to try and catch up kids who have been missed by the routine system, where routine systems haven't got the coverage high enough. So we do that already for sure. We also have a whole department, not represented here today, but that looks at training. And so I think it's a great idea to have some kind of training that WHO could provide to help support, again, health workers in how do you address vaccine hesitancy. That kind of thing does exist in some countries, and it has to be adapted to the local culture, to the local language, and to the local issues that a country faces. So, we really, if a country comes to us and says we need this, we will do our best to try and help provide it one way or another. And many of our regional colleagues have already done this kind of training in other areas. So I'm sort of being very general because I'm not completely sure what the question is. But if Nadine, if you follow up, we can try and be a bit more specific about that.
Thank you very much. And if the question is about public health campaigns, Lisa, do you have any best practices, or like what would be WHO's key guidance for a successful public health campaign to motivate a vaccine uptake?
So yeah, very interesting. And so here's some insider information in a way. So really it's a step-by-step process, and it starts by listening and developing an understanding firstly of, for example, for immunization, why is there low uptake of a certain vaccine in a certain context? We know that these drivers can be very context specific. They can also change over time. So what we aim to do is firstly start by looking at the multifactorial, all of the various drivers of vaccination uptake, and then using that as a basis for planning. And we then take those inputs that are about access, the social influences, people's attitudes and beliefs, etc. And we compile that and use that as a basis for then designing targeted and tailored interventions to perhaps better support health workers, better share more accurate information, better work with champions or advocates, and equip them for the local conversations that can take place that are supportive of immunisation. And we then work with partners to implement these different types of strategies. And we also continue to listen and learn and improve these strategies as things change over time. So it's really this iterative process with continued monitoring and listening so that we take on all of these various inputs and think about all of these various drivers and have a holistic strategy. So in a way, that's how we operate.
Can I just do
Please,
a couple
please.
of stories? So, and this is not as scientific as your beautiful summary, but so just to tell two stories. One was about a community that was understood widely to be anti-vaccine until actually people went and asked the community what was the issue, and this is about the listening piece, and found out that actually the services were not adapted to that community, and in fact that community was not well received in the context of their country. So they actually wanted to get their kids vaccinated, but basically when they showed up at the clinics, everyone was incredibly rude to them. And so they said, well, why would we go and get our kids vaccinated if people are going to be horrible to us? So, I mean, that's just one example of where, but the narrative was, oh, they're anti-vaccination, but it actually wasn't true. And another story where, again, a community was thought to be anti-vaccine. There was low coverage in a particular area. One of my colleagues told me they went to do an investigation to find out what was going on. And they found that the person who was running the local clinic had left a year before and hadn't been replaced. So there wasn't actually anybody to deliver the vaccination, and they thought the local community had become very anti-vaccine. So I mean, they're just two examples, but just to try and make it a bit more concrete, that unless you go in and ask the community what's going on, you won't know what's happening, and you must never jump to conclusions about what's really happening.
Thank you very much. We actually had two viewers who wrote about, they didn't specify where they're coming from, but they wrote about surge in cases in their communities. So one question was how WHO knows when there is an outbreak, and the other viewer was feeling that there's nothing done about the outbreak. So maybe we can say, how do we know when there is an outbreak, and what do we do to help countries deal with outbreaks?
Okay, I guess that's for me.
Yeah.
So thank you for the question. Every country has or should have good measles, what we call surveillance, in place. So if a case does occur, it should be reported to the public health authorities. it should be tested in a laboratory, and as soon as a case is found in an area where there's an outbreak, there should be a very rapid response. Now, that doesn't happen everywhere, but that's the ideal. And so what we do is we support countries at various levels. We support from here in Geneva, we support in our regional offices, and we support in countries where to help countries make sure that their surveillance system, which is their disease listening system, we were just talking about listening, so this is how we listen to find out what's happening with the diseases, that it's working, that it's strengthened, that the labs are working properly, and then that when there is a case, that it's jumped on very quickly, because that's very important. And as I said, we're heading into this really difficult year where we think there's going to be a lot more outbreaks in a lot more places. And so the things we've been really pushing is firstly getting ahead of it by trying to catch up any kids who aren't vaccinated. But the other thing is the outbreak response, and making sure that as soon as a case is identified, that everyone gets onto that case, vaccinates everyone who's around that case and in that area, and manages the cases as well as you can. And I should say there's actually no treatment for measles, so it's completely supportive. So there's, the best thing to do is to stop the outbreaks happening at all, and then the second best is to really respond to them very quickly to protect as many people as you can. I've gone a bit beyond the question, but hopefully that covered
Thank
it.
you very much. Natasha, I want to ask you one more question. There are a few questions that we received about side effects of the vaccine. So what are the side effects that measles vaccine or MMR vaccine can cause?
Yeah, so it's the side effects are very uncommon. If you compare them with the complications I talked about earlier of measles itself, one of the common ones is that people can get what we sometimes call a mini measles-like condition. So it's like a mild version of measles. You can get a little bit of a fever and a rash and these irritated, inflamed eyes as a result, because the vaccine is a live vaccine. So it's basically a disabled measles virus, and it can occasionally cause a measles-like disease. That doesn't spread to anyone else. It doesn't have any serious consequences.
How long can that last?
And it lasts a few days. It's like a very mild version of measles. There are also sort of, sometimes people get a bit of a local reaction. Sometimes they get just a fever. Like kids can have some reactions. They usually happen. They're a bit more delayed than what happens with other vaccines. If you have, because this is a live vaccine, it takes a bit longer for the side effects to show. I mean, I'm talking about a few days, not longer than that. And when they're over, they're over. That's the end of it. There are there's one much rarer reaction which causes a problem with your platelets. So that's very well recognized reaction. It's less common from the vaccine than it is from the disease. So even though it's a recognized side effect, and any side effect is not welcome for vaccines, it doesn't have any long-term consequences, and you're more likely to get it from measles, which is why we recommend the vaccine over getting measles, obviously. In terms of the really severe side effects that you get, or complications, I should say, of measles, they don't happen with the vaccine. So any of the other things I talked about are not seen with the vaccine. So it's an incredibly safe vaccine, and as I said, we've had 50 years of experience in millions and millions of children, and so we're at the point now, in my opinion, where no child should die from measles anywhere. That should not happen anymore anywhere on this planet, but we're still seeing deaths from measles, and it's just not fair. It's in the poorest children with disadvantage of every kind you can imagine, and we could stop it. So I'm speaking up for the vaccine, but I really feel like, every measles death is a preventable death that we failed to prevent.
Thank you so much, Natasha. And maybe for the end of this conversation, I think we addressed most of the questions that we received today, directly or indirectly. I'm trying to read through as you're speaking. What would be, looking into this situation that, as you said, we're losing children that we shouldn't, and that measles is on the rise. What would be your message to our viewers? What do you want them to remember from this conversation?
Well, please get yourself and your children vaccinated is the first one. I think one thing that would be great is if people could also speak up for vaccination. We really struggle at global level to get measles the attention it needs. Of all the vaccine preventable diseases, we save more lives through the measles vaccine than any other vaccine. And yet we don't put it at the top of our list of priorities. I think there's kind of a feeling that, oh, it's just measles, or it's just, I don't know where it comes from, but I sense it all the time. There's always, it just doesn't get that focus. The new vaccines get a lot of excitement. This vaccine's been around a long time. People just don't give it the priority I think they should. So I know that people may feel that they don't have any power to change that. But if you want to do something about measles, if you can speak up for the vaccine and speak up for the unfairness of children in low-income countries dying from measles when they don't need to, the voice of countries is incredibly powerful. If a country says to WHO, we want you to do something about this, WHO has to do it. We're obliged to by our mandate. So, your voices are important. So please speak up for the vaccine and speak out against measles. It just shouldn't be happening.
Lisa, your thoughts?
Yeah, I mean, I absolutely agree with Natasha. I would also add really and emphasize that everyone has a role to play in being well informed, to turning to trusted and accurate information sources just to answer any questions and concerns, and thinking about the people around you in your family, your friends, your community, and really exploring whether there are ways, having conversations about vaccination in general. We know that this really is one of the most important preventive health interventions, the safest, and there's no reason in many ways for people to have questions and concerns about vaccination. So everyone has a role to play in helping to look out for accurate information and in going to trusted sources for that, but also having conversations and connecting others, maybe looking out for people in your community who are disadvantaged or who are maybe having trouble accessing health services because that health centre is really just a little bit too far or not offering services at the right time of day. So maybe how can you help connect people in your community who might be struggling to those health services? And think about not just immunisation, and particularly for young children, there are maybe other health interventions that can be covered at the same time. So I think just looking out for others around you, having those conversations, and even if you do have the opportunity to also speak to your local elected official who does have probably a more prominent role in thinking about planning and investment of health services and all of these campaigns that do include immunisation, also thinking about finding ways to support them in their work in being active champions for vaccination as well. So this can be addressed by everyone in their community and at different levels of society as well.
Thank you very much, and I hope that our listeners will take this forward to their communities. One question that I missed to ask Natasha, is measles a disease that can be eradicated?
That's a difficult question to answer. Personally, I believe it can be eradicated and it will be eradicated. It's just a question of when. And I would like to see us get there. We're now at 40% of countries in the world having eliminated measles, which is means that there's no measles in that country. Eradication means it's gone from the world. So we have 40% have achieved it, and they've managed to hold on, most of them, during the pandemic. So we know it can be done, even in quite low-income countries. We have more than half the countries have eliminated rubella, which we haven't spoken about, but rubella and measles are now given together in the same vaccine. So this is incredible, and so more than half the world has eliminated rubella. So I think we're going to eradicate that. We're on track to do that. It would take a huge global effort to get to eradication. I believe it will happen one day, but it will take some time.
Thank you very much. I do want to apologize to our viewers on X because I noticed that we had some drop in connection only on that platform. We will work on resolving that technical issue for future sessions. Apologies for that, but I see we are live back on X now. So for the section that you missed, you can watch on YouTube. I want to thank all our viewers watching us from Kenya, Mozambique, India, Burkina Faso, Pakistan, Ireland, Tunisia, the US, Nigeria, Canada, South Sudan, Zambia, Pakistan, Iran, Cameroon, Ethiopia, Morocco, Bangladesh, Somalia, Tanzania, Mali, Oman, South Africa, France, Brazil, Mexico, Sweden, Eswatini, Ghana. Long list of countries. So I really thank to all our viewers for being with us today, for all your questions. If you'd like to see more information on measles, you can visit our website. We have fact sheet on measles. We have other pages on vaccination. Any concerns as well on safety and how WHO ensures safety or assess safety of vaccines. There's quite a lot of materials on our website, but we also put out often content on social media. So please follow us. And if you find this information useful, please share as well digitally, not just, as Lisa was saying, talk to your community and or your local leaders. We also encourage you to share credible content on your social media channels so that your friends who may not be physically around may see it. So until next time, please stay safe and goodbye.